So good morning, everybody. And thank you again for joining our Latino Unity Day 2021. My name is Sara Cartagena, and I'm the Immigration Analyst at the Latino Policy Forum. And I will be serving as the moderator / host for today's session. We are very excited to have a conversation today about human services, the impact they have on Latinos in Illinois, which programs and initiatives we should know about, as well as should be elevating and advocating for. Human services are a critical component of our society. They provide a wide variety of social safety net programs to our communities. And this has never been more important than now, when we are all going through such a difficult time and when the pandemic is hurting the Latino community so deeply. Now, given that human services encompasses such a large array of programs and services, for this session, we are focusing on those that provide to the immigrant community. Considering that roughly 42% of the foreign-born population in Illinois is Latino, and roughly 75% of our undocumented population in Illinois is Latino. Also, we know much of the direct federal relief for COVID-19 has excluded a large portion of our immigrant population, and it is particularly important to ensure that with the incoming funds to Illinois from the American Rescue Plan, that our state continues to add funding to critical programs, such as the ones that are going to be mentioned today in this session, that are ensuring that our Latino immigrant communities and families do not have to face these difficulties alone. Now, without further ado, we are very excited to welcome two amazing speakers to share in more detail the indispensable human services and work that they and their agencies are leading for a Latino immigrant community. First, we have Lillian Jimenez, who is the Associate Director for the Office of Welcoming Centers for Immigrant and Refugee Services at the Illinois Department of Human Services, whose office oversees the Welcoming Centers program, the refugee program, the immigrant integration line items. She's also helped oversee the emergency assistance that's gone to our immigrant communities, among many other initiatives. And we have Evelyn Venegas, who is the Family Support Network Coordinator for the Illinois Coalition for Immigrant and Refugee Rights, also known as ICER, to speak about the amazing programs that ICER is leading, such as the Immigrant Family Resource Program, the COVID-19 Immigrant Family Support Project that has provided cash assistance to those who are ineligible for stimulus checks, and to share more about ICER's legislative platform. So now, before I pass it to our first speaker, Lillian, I just wanted to remind everybody to please enter any questions that you may have for our speakers in the chat, and we'll leave a few minutes at the end for questions and answers. And so with that, Lillian, please, you have the floor.
Hello, everyone. Thank you so much for joining us. Again, I'm Lillian Jimenez, Associate Director of their Office of Welcoming Centers. I had a little PowerPoint to share, so I'm going to try to share that right now. Can you see that?
Yes.
Is that better? Okay. Yeah, so hello everyone. Here at IDHS, we've been working really hard this past year to make sure that all of the services and all of the benefits that are available to all of Illinoisans are specifically also available, and that there are no barriers to these services for our immigrant communities and other hard-hit communities. So I'll be a little bit talking more from the immigrant perspective, but I also have my partners at the Office of Adult Basic Support Services that really have a lot of programs that focus on other vulnerable communities. And we also have the Office of Rehabilitation Services that make sure that families and households living and individuals living with disabilities are receiving services. So we have a wide array of services that I would love to share with you at another point. But today we'll be talking about the Office of Welcoming Centers, which is what I'm the Associate Director for. So this past year, as you know, the Latinx Caucus and the Governor and all of you have really supported the Office of Welcoming Centers to try to address the financial hardship that immigrant communities in particular have been facing in Illinois. So we know that all of our communities have been facing this COVID pandemic and financial hardship, but immigrant communities, due to so many different factors that you are aware of, like many folks being essential workers, many people being undocumented, many people not having healthcare. So this has just exacerbated the situation that we have been working to address for many, many years, and the COVID has just exacerbated the situation. So to address that, we were so happy to have support from the community, from folks like you, so that we can help provide some of these funds that are coming from the federal government, and also for general revenue funds to immigrant communities. So you'll see here that we did have these pilot projects in FY21, Housing Utility Assistance Project, Employment and Training Project, Public Health, also known as, we called it a Health Navigator, but we were really building on the Promotoras de Salud model here for this program. And then we did do a more of a public relations campaign. So we did some, some people, you may still be seeing billboards. I saw one the other day on, I believe it was on Cermak near Ashland. There was still an ad up from that piece that we did, as well as, some of my local grocery stores. I still see some up from what we did. That funding was initially supposed to end in December. So much of those funds were spent before the end of December, but we received an extension when the federal government decided to extend it in late December. So some of them went into January, February, and March, but for the most part, those funds, they were already allocated. And we feel that our strength here at Office of Welcoming Centers is that we're providing these funds that you see here in a community-based model. That's the important part here, right? Because we have DHS at large has many benefits and services, and you are able to go to a local office to sign up for benefits and services, especially if you are a U.S. resident or U.S. citizen that is eligible for those services. However, we know that many of our communities in the immigrant community have a hard time, may not be eligible for these services, or they may not feel comfortable that there's not the culturally appropriate services that we wish and we are striving to have. But at the same time, we feel that this dual role of government is also to provide services to community-based organizations, like you'll hear from Evelyn from ICER talk about their role. But there are many organizations that we work with. And through these CARES Act pilot projects, what we were calling them because it was temporary funding, we opened up the door and we asked our Welcoming Center partners, as well as any community-based organization that wanted to participate in these projects. And so we were really excited, and I can share actually something like 30-page report that our amazing senior immigration fellow Ruth Lopez McCarthy put together, and I can share that larger final report with all of you if you're interested. But again, the strength here is a community-based model. So all of these programs that you see here were provided to community-based organizations, nonprofit agencies for the most part, who were, we believe, well positioned to provide these funds in a culturally appropriate manner and with the language capacity that we needed. So I'll let Evelyn talk about the immigration integration piece, which you will see here. The total amount that was allocated to that. Did I have that wrong? I'm sorry. That's 30 million. If you add that up, sorry about that. And the Illinois Welcoming Centers piece is 5 million. So again, I spoke about the CARES Act, so I'll just, go over it a little bit. These were the 4 programs that I talked about. And then in addition to that, we had the 5 million that was allocated for the Office of Welcoming Centers. And so what we were able to do with that, the additional funds, and again, I can't miss thanking the Latinx Caucus and the governor and all of the support of the advocacy organizations that made this happen. They were meeting with us back last March and April to make sure that these funds were going to be allocated and increased for these communities. So the Office of Welcoming Centers, we were able to hold a second notice of funding opportunity to add to our current 17 agencies. We added 14 agencies in the fall through a public notice of funding opportunity, bringing us up to 31 community agencies. And for those of you who know us, who've been following the Office of Welcoming Centers, this is a great accomplishment. We were established in 2007, out of the Secretary's office, and had, one small office at the beginning and then a couple offices, and these were mostly government-run offices with government employees. When we switched in 2017 to a community-based model, is when we started working with the 17 agencies that we had when I came on board a year ago. And then, as I said, now we have 31 agencies thanks to the 5 million that we have allocated. So I just wanted to give you a snapshot of what was the accomplishments. You know, and this number here at the top, this was from our final report that we had to submit, but Evelyn actually may have different numbers that are a little updated for that. But this was a snapshot as of when we did our final report of the amount of folks that received cash assistance. So that would be $1,500 to support them. This fund was really targeting undocumented and mixed status families that did not receive the first federal stimulus. We were again, with the advocacy groups back a year ago, trying to figure out how we could address the enormous gap that was created when the federal government decided to leave out a huge part of our community, the undocumented and mixed status families. And so that was the effort there. With the household assistance, with rental and mortgage assistance, you can see we helped over 5,000 families. That amount was a larger amount, which is why you see a smaller amount of people that were impacted. But it was up to $5,000 that folks could receive to make sure that they weren't evicted, to make sure that their homes weren't foreclosed on. And then again, you see the 2,800 that was with utility assistance, and also 2,500 referred to social services. We also, you know, did employment. You know, I won't run through all the numbers, you can see them here, but we trained community navigators. That was a project that was very close to my heart. I really, you know, thank the organizations that stepped forward to work with the community navigators to recruit their promotoras de salud, you know, based on, you know, the promotoras de salud programs that they already had in existence. And we did that training, you know, so we reached to 20,000, as you can see here, members of the community. And I'm sure many, many more, but, you know, this was the folks that were touched by the program that all of you advocated for so vigorously. And then, of course, we did our public relations campaign that, you know, I mentioned at the top, where we reached individuals through social media, by message, by phone, in many different ways. So again, here, you know, just a snapshot of, you know, the impact that we had. This was the Housing Utility Assistance Project. These were the organizations that participated. At the bottom here, you see the Welcoming Center partners. At the top, you see other organizations that joined us in this program. And you can see kind of the reach, a lot of focus here on the Cook County area in Chicago. But we also were able to reach all these different parts of Illinois, and that was intentional. Of course, we are always trying to find partners across Illinois to make sure that we are addressing, and we had a couple of organizations that may be here today with us that, you know, we just did a tremendous job helping us reach central, southern, and northern Illinois, like Western Illinois Dreamers and the Illinois Immigrant Council and Casa Michoacán. All these organizations that you see here, you know, I can't give a shout out to every single one of them, but they did amazing work in all the different areas that they were in, and we were so happy to partner with them. And then, you know, this is again a snapshot from January, so not complete numbers, but, you know, from our initial reports of the different types of assistance people were provided from the Housing and Utility Assistance Program. And then finally, I just wanted to, you know, we could, if you have other questions, we can get into it, but I just wanted to show you our Welcoming Center coverage right now with our 31 agencies. You know, there's still some areas we'd love to see it all blue here, but here are some areas that we are covering right now with our program, and very proud to continue to support these organizations. For FY22, you know, people maybe have questions that, you know, what's our standing for FY22? Well, we do have flat funding at this point that is in the governor's office. So we're in contract season right now, planning with our welcoming centers that you see here, with ICER, with the Jewish Federation, with all our different partner agencies to work on their contract for next year, so they can have continuous funding and that there won't be any gap in services. And so that is the state of the situation right now. If anybody had questions about it, that might change, of course, but due to your advocacy. But as of now, these are our welcoming centers. They're all receiving flat funding for whatever they receive for FY21 to FY22, except that there is a notice of funding opportunity because of federal GATA rules. We do have to open up the funding opportunity every 3 years. We've been doing that with all of our organizations since those rules came into place. So all of the 17 agencies that have been with us for 3 years are eligible to reapply. But right now there is a short period of time right now where we're making decisions on those organizations, and depending on which one of them asked to continue in the program, we are considering them at this point for FY22 funding, for those that are going through the NOFO process. The last thing I wanted to share was just that we are also venturing into an eviction prevention program right now, which we're starting to call housing help. But this is funds that were allocated by the federal government specifically for eviction prevention, for rental assistance. So it's a little different from what we did before. It's not going to include mortgage. It's specifically for rental and utility assistance. And the Office of Welcoming Centers is part of a bigger program. The IDHS and IDA are working together. And so, some of you may hear more from IDA at a different time today, and they can go into their larger program. It's something around, $400 million program to work with landlords and tenants to prevent eviction. So our piece of it is that for this fiscal year, we did have $5 million allocated to the Office of Welcoming Centers, and we've distributed that to the partners that already had contracts so that we could get it out quick, right? Because the funding that we received last year ran out, like I said, mostly by December. Some of it kind of went into January and February, just so we made sure everything was allocated, every cent, right? We didn't want to send any cent back to the federal government when we know that there's such a need here in our communities. So that was gone. And so as of April 1st, we worked with the organizations that were able to spend down their contracts and reach people who had wait lists, right? Because 20 million was a drop in the bucket for rent housing assistance. And so we worked with those who still had waiting lists to bump up their contract. And then now for FY22, we know that we have also 7.5 million allocated for the same project, which I can share more at a later date. But right now, the notice of funding opportunity is open. So I can share that in the chat. I can share that with those of you who haven't received it. We tried to get it out last week. It just came out a couple of days ago. So any organization that is interested in utilizing federal funds to provide rental and utility assistance in a community-based model. So that means they receive the funds, the organization receives the funds, and turns around and is able to work with the tenant. And so here, the important thing here, again, is that we are trying to be an alternative model to what IDA is doing. Not because we don't think what IDA is doing is wonderful, but because we feel that our communities really need a different approach, a culturally appropriate approach, a one-on-one approach. And we need them to be in a situation where they are comfortable. Not everybody is comfortable giving their information to government agencies. And there's reasons for that we all know and understand. So we feel that a community-based model is really is a complement. Is a complement to the broader project that IDA and IDHS are working on. So we have the big project that IDA is working on, it's like 400 and something million. We have the continuums of care that some of you may be familiar, where IDHS is dedicating, additional $40–50 million for rental assistance. And then we have our piece where we're working through community-based organizations. And so we feel that that individuals who are undocumented, some of them, they may be living, in some of those areas that I showed you, in some of the counties, in Cass County, in Lawrence County, some of these areas that they don't have just familiarity and comfortableness with the FCS, the FCRC.
Se ve con otro médico.
So those organizations that I showed you earlier really are in the best position to reach those families. They go out to families, they find the families, they know who they are, they know what churches and laundromats they go to, and they can reach the people who we really, who aren't going to know about the bigger, broader project. And another piece, as I said at the beginning, we do have a public relations contract where we're trying to help IDA and IDHS together, trying to promote our services to those communities that are less likely to already know about those services. So I think with that, I'll let Evelyn talk more about the ICER program, but if anybody has any questions, any more information I can provide to you, please let me know. Thank you.
Thank you so much, Lillian, for sharing that and sharing the incredible work that the Office of Welcoming Centers is doing and the partner community-based organizations. And as you mentioned, just hearing that you were able to increase an additional 14 welcoming centers in the state is huge, but we would love to see that whole state blue, right? We would love to see a welcoming center in all those areas where it's needed, where we know that there are Latino immigrant families that need a welcoming center to be able to access these programs. And so we really want to encourage our partners who are on the call, participants, to really advocate for additional funding to make sure that there can be a welcoming center in every part of Illinois where our families need them. And of course, we would also love to see some of that American Rescue Plan funds, similar to the CARES funds, go to these welcoming centers to be able to continue those programs, such as the Community Navigator program and the Rental and Utility Assistance program. So thank you, Lillian, again. And with that, I will pass it to Evelyn to talk more about ICER's work.
Hello, good morning, everyone. As mentioned, my name is Evelyn Venegas. I will be talking today about ICIRR's organizations that they overlook. I do have a small presentation, and at the end, we will also cover some of our platform for this legislative season. And so, as Lillian mentioned, there is, the immigrant services line item that is part of a budget of the state of Illinois. And in that budget, there are 3 specific programs that ICIR actually overlooks through our coalition member organizations. Next. And those are 3 specific ones, but these are 2 right now that I wanted to mention, and that's the New Americans Initiative program, which is basically 50 organizations statewide that are funded to directly assist immigrants to become U.S. citizens, as well as applying for helping applications with DACA, whether they're new or whether they're renewals. In the past 4 years, the New Americans Initiative has assisted over 100,000 immigrants become U.S. citizens, and about 7,000 youth obtain DACA. And this New Americans Initiative is, again, focused in the idea that we understand that some of the barriers that our community faces when trying to become a U.S. citizen, and that could be language, that could be understanding the civics exam, and that could even be understanding if they are eligible or not. And so the New Americans Initiative focuses on making sure that one, these funded organizations are supporting our community at every step of the way, meaning they provide either ESL classes, they provide education, or they also provide, accompaniment all the way up until their interview, as well as their oath ceremony. Because we know that in the past couple of years, we've known that folks are only safe when they are U.S. citizens. We have seen even other things happen when it comes to deportation, and this is why we make sure that legal permanent resident folks that may be eligible to become citizens are aware of the benefits that, being a U.S. citizen provides to them. And then additionally, we also see the need and the increase because of the latest changes that have come through DACA. Here only in the state of Illinois, from 44,000, there is now 66,000 eligible people who might be eligible for DACA, given that it changed in this past December, opening up for new applications as well as renewals for 2 years. And so we know that given that that has changed, NAI is now being very much influxed with applications, whether they're new applications or renewal applications. And for us, we are asking for FY22, 3 million more funds for NAI, specifically for this change that DACA has created, and obviously more people being eligible to apply, meaning more organizations need to provide more legal services, right? And so that's the New Americans Initiative. We also have the Immigrant Family Resource Program, which is a statewide network of 35 ethnic community-based organizations operating in 59 different languages, and all, to providing equal access to health, safety net programs to immigrants and refugees. And, you know, as Lillian mentioned, this is very important because we do know and we understand that a lot of our community would like, you know, the comfort of even speaking in their own language to ask for these type of either safety net services, understanding healthcare here in Illinois. And I think it's really good to say that, you know, Illinois is one of the most welcoming states that we are able to provide certain healthcare needs, certain safety net services to our, you know, vulnerable populations. And the Immigrant Family Resource Program already has that structure, right, of having understanding of where the community is, where can they actually do outreach, information, and provide, you know, as things were happening specifically last year, being able to provide that you know, trusted communication as, hey, you know, regardless of your status, you're able to get COVID testing, you're able to get COVID, you know, healthcare. And you'd be surprised how many folks are still worried, specifically with public charge, that they may not be able to adjust their status. And so the Immigrant Family Resource Program does a very good job in making sure that that outreach, that information, as well as that, you know, sensitive to culture, sensitivity culture is there, and understanding what our community needs. And so the next slide, please. In this last year, we also were able to, with IDHS, create the Immigrant Family Support Program, which basically, as Lillian mentioned, was for the aim of making sure that those households and families who did not benefit from a stimulus check were not left behind, because we also know that these were some of the groups that were most hurted throughout this past year, and their needs were different than a lot of other folks. And so just a couple of numbers from the Immigrant Family Support Program, we actually had 14,000, close to 15,000 applications come in last year. And the average household size from these applicants were actually 4 folks, and the average income from these families were $20K. So just by those numbers alone, we know that, you know, the last year hit differently to specifically vulnerable communities. And we can, the next slide, please. We can also see that when it came to the applications, we also did ask, in order to get this information, right, what were the biggest needs that folks needed this money for? And this year we were actually able to see that number 1 was rental assistance, and number 2 was tied with utility bills and food and basic supplies. So a lot of these funds that, you know, otherwise would not have been able to go to these families would have made a huge difference in order for folks to be able to continue on their lives and just being able to live or to rent where they were living. The stats are not up here, but we also did find that the most folks that applied to the IFSP fund were actually renters, not homeowners. So we know that those funds really made a difference when it came to them having a secure, you know, place to stay. Additionally, we also saw that a majority of the folks who applied for the fund were also majority uninsured, didn't have any form of health care. Some were underinsured, some were uninsured. Only a few were actually insured, but the majority were uninsured. And then additionally, very compliment to Lillian's map, we see that our applications, the majority of them actually came from outside of Chicago in the Collier County counties, which is DuPage, Will, Kane. And we saw that a majority of our applications came from there and the southern area of Chicago. We wanted to split up Chicago just to get a sense as to where exactly were the most hurting areas, communities, neighborhoods from the city. And so we saw that the north side had significantly less than the south side of Chicago. And so the number 3 areas from Illinois that applied to this fund, again, were the Collier counties, the Chicago South, and the suburban Cook County as well. And we know that we tried to make sure that we were able to do outreach in the southern areas of Illinois, making sure that we know. Currently, we also do know that a lot of folks have been migrating out of Chicago into either Southern Illinois, Western Illinois. And so that was part of our challenge, right, to make sure that folks were aware that this fund was open, and regardless if they were close to Chicago or not, they were still eligible for this type of fund. And so it was very much twofold: providing information and education about the fund and how many people were eligible. And then the second part, actually supporting people in their applications. And for this, we were actually able to utilize the structure that already existed within the Immigrant Family Resource Program. As mentioned, they are 39 organizations in 59 different languages. And so it was actually those organizations that helped folks apply for these funds. Initially, we did try to have folks apply by themselves, and we noticed that there wasn't just a language barrier, but also not understanding exactly what the information we were asking for and why. And so this is why we switched the model around summer in order to make sure that IFRP programs were able to help folks apply for the IFSP fund. And this is a continuing program. We're actually still wrapping up, providing cards to the last folks who applied, which would have been in January of 2021. And for the Immigrant Family Support Program, we are actually asking for an additional $10 million in funds for FY 2022. And a lot of that actually comes from also seeing an increase of asylum seekers during this past year, as well as past years, really, and knowing that some of them did not necessarily continue on with their asylum process. And so we're also understanding that there might be new undocumented folks, right? And our target needs to change to focus on them as well as a new population here in Illinois. And so that's just kind of some information in terms of the IFSP, IFRP, and NAI programs. And part of this, as Lillian mentioned, is because we're advocating at a state level to try to make sure that all of these programs are funded at level funding, or if not more, as we see the need that is coming from the community, coming from the ground, and understanding that it's not just, a lot of folks understand it as, the pandemic is ending. The reality is that right now we're beginning to see the real consequences of folks having, endured a whole year of possibly not working, reduced hours. We also know that summer is coming, and so we understand that that may also change some things as well. And then again, also policy changes such as DACA have now increased the need in terms of legal services for the New Americans Initiative. And so, as I mentioned, many of these programs need constant advocacy in order for them to be properly funded. And part of that also means pushing our legislative platform. Next. And so I wanted to speak briefly about our legislative platform. We are focused on 3 main topics, and the first one we're going to go over is going to be safety for all. It means that ICE needs to be completely separated from local police, and that the state divests systems that are harmful and that they invest into our communities. And for this plan, we have the Illinois Way Forward Act, which basically further restricts police from cooperating with Immigration and Customs Enforcement. And we see this as a very important part of providing safety for all, because even during this pandemic, there was definitely still situations where people were getting picked up by ICE, or where we were able to find out that police were cooperating to an extent with ICE, right? Continuing that pipeline of police and immigration detention. And so the Illinois Way Forward it has a lot of support from legislators currently, and so it's in a good place to hopefully pass. Additionally, we also see the right to counsel, which is basically universal counsel for everyone. I'm not sure if everyone knows, right, but sometimes it's difficult to actually get legal counsel for folks that are in immigration proceedings, because one, they're either moved really fast from detention centers for the purpose, right, of not having that legal counsel. And then the second thing is very different from criminal law, immigration law does not provide a public defender, right? A person has to be able to identify a lawyer and be able to seek counsel by one in order to be represented by one, which is different in civil law, right? Because we get public defenders if we don't have a lawyer in order to make sure that we're going to court represented. And so we know that that is definitely a need, and that is why we are also focusing on making sure that folks who are in detention, immigration detention, do get a right to counsel, to understand their rights, to understand what is the possibility of getting bonded out. And so these are the two acts that we're focusing on in order to push our, idea of safety for all. Next. The next theme for this is healthcare for all, meaning that all our communities receive quality healthcare, including COVID services, regardless of their immigration or insurance status. And so for this, we are introducing the Health Equity and Access to Care Act, which will ensure that most hospitals provide better access to care for uninsured patients while increasing transparency and accountability. Within the last year, we definitely did hear of a lot of situations that arose specifically because of the pandemic, right? Because of not being able either to access there are no more clinics. Folks ended up in the hospital for different reasons, right? And it was at that point that we would get calls in terms of what am I eligible for? How can I make sure that, I don't get charged for everything? And so we definitely saw an increase of need for making sure that everyone is covered in Illinois with healthcare. And so this is why we were able to begin this CARE Act. And we want to make sure that, going forward, folks, regardless of the immigration status or insurance status, are able to seek healthcare, whether it is COVID related or whether it is, just their healthcare overall, which is very important during these times. And next slide. The last theme that we have is economic security for all. Right, we definitely saw that our communities definitely hurt a lot during the past year. We saw many folks, even from the numbers of IFSP, didn't have the opportunity to work. They had hours cut, or they had, loss of job security overall. And for the economic security, again, going back to, we want to make sure that the immigrant services line item, which is a safety net program, which houses the safety net programs of the New Americans Initiative, the IFRP, and the IFSP, are funded and are increased because of the need that we are beginning to see on the ground, right? We understand that, as I mentioned, for many of us, it seems like the pandemic might be over and that we are moving forward, and we are. But at the same time, we also have to see that our communities are hurting, and many of them, we won't begin to see the effects until after everything begins to reopen, after we begin to see, okay, what was actually going on that we may not have heard of during this past year. And so we know that that is part of the economic security for all, as well as an earned income tax credit expansion, which basically would provide relief for people who are excluded currently from federal tax credits. And this includes low-income childless adults, those that are 18 to 24, seniors that are 65 and over, and people filing taxes with ITIN and unpaid givers. We definitely saw that within the last year, these were some of the most hurt populations within our vulnerable communities, and making the earned income tax expansion would provide, some form of relief for them when it comes to tax time, and making sure that they are also getting their federal credits in order to help them during this time. And so these, as I mentioned, were some of our themes as well that go with the acts that we are focusing on and trying to pass here in the state of Illinois. And so lastly, I just wanted to encourage you all to take action. You could text welcoming ill to 52886 to contact your state senator, your representative, asking them to pledge their support for this platform that we just laid out. And we want to say thank you so much for your support. And if you have already signed on, thank you so much. And that is it for me. Thank you so much. Let me know if anyone has questions.
Thank you so much for sharing that really helpful and meaningful information, Evelyn. And so to reiterate, some of ISER's platform is the Illinois Way Forward Act, the Right to Counsel in Immigration Proceedings Act, the Health Equity and Access to Care Act, the EIC expansion and increases to the immigration integration line items, as well as increases to the Immigrant Family Support Program for 10 million and increases of 3 million for the New Americans Initiative. And so given this great work and that you shared that the audience, participants and partners can text for action to contact their legislators, is there any advice that you can give in other ways that they can participate in this advocacy?
Yeah, I would definitely also say connecting to our community organizations. They do actually different advocacy days that focus on their, possibly identities or the communities that they serve. And so I would definitely say check out our website, icirr.org. You're able to see a list of our partner organizations and reach out to them and see how on the ground you can support them becoming a volunteer. I know folks sometimes need even interpretation services. So any way that you see, what a skill that you would want to provide, definitely reach out to organizations or send us an email as well. We could definitely connect you with what you might be looking for.
Thank you.
I'll quickly add that with the permission of Evelyn and Lillian, we'll try to share the materials that they presented today with the group. We'll be doing a follow-up packet so people know, can revisit these points, of course.
Definitely. And so we have time for one last question, if anybody has a question out there.
The information was that thorough and clear. That's why there's no questions. Well, while people think about it, just want to kind of lay the foundation for what we're doing next. There is a 5-minute break, so 11:20 to 11:25. If you are interested in seeing the next session, which is in this link, which is education, stay here, don't disconnect. If you're interested in the concurrent session 4, which is COVID-19 recovery health, then you're going to either register or look up the link that you already received that's titled concurrent session 2/4. If you have any questions, you can ask them now, or you can email me, rvaldez.jr@latinopolicyforum.org. Just wanted to plug that in quick.
Thanks, Roberto. And I guess with that, since we're coming to a close, just wanted to ask our speakers if they have any final remarks for our audience.
Just want to thank everyone for all the work they do every day, and I love to be in contact. So for those of you that I haven't met, I'll put my my email in there, and love to set up an appointment to touch base with those of you who are interested. Thank you.
Thank you all so much. I will also drop in an email in case y'all have any questions on how to plug in, how to support. Thank you.